Hello.
Take two.
Good afternoon, fellow pet parents. Welcome to another Facebook Live session here on Pet Parenting PH. Today, we are joined by two very talented veterinarians here at Peralta Vet Center in Parañaque City. First off, let me tell you a little bit more about this PAHA-accredited clinic. So, Peralta Vet Center was established in 1990 by Dr. Pedrito Peralta. Since then, they have been providing quality vet care as they offer a variety of services such as consultations, vaccinations, deworming, confinement, dental procedures, and surgeries. They also have their own in-house laboratory, x-ray, ultrasound, and surgical equipment. Here we have Dr. Carlo Peralta, who earned his degree on Doctor of Veterinary Medicine from De La Salle, Araneta in 2013, and his professional license in September 2013. He took over the family practice right after getting his license. So another doctor who is also joining us today is Dr. Henry Cabrillo. He obtained his degree in Central Luzon State University and got his license in 1998. He's been with Peralta Vet Center for 17 years already. So, Doc Henry, can you tell us more about our topic today, which is Ehrlichia, or blood parasites in dogs?
So, Doc Henry, what are blood parasites in general?
Blood parasites, these are parasites that lives on the host cell, specific on the blood, and the white cells are the one affected, and the platelets.
How common is Ehrlichia here in the Philippines?
Ehrlichia is very common. In our practice, it almost account 80% of our patients. And I think this is due to the vector, the carrier, the brown dog ticks. They are the one that carries the blood parasite from dog to dogs. And but anyway, the disease is not transferable to humans.
Okay. So, which dogs are prone to Ehrlichia? Is Ehrlichia only for dogs?
Yes, these are only for dogs, though there are cases also in cats. The common breed is the German Shepherd. They are the when they are affected, they are the most very vulnerable to the disease.
How can Ehrlichia affect the dog's body?
Ehrlichia, they multiply on the host cell, as I mentioned a while ago, specifically the white blood cell and the platelet count. So this one leads to low immune system, and also some vital organs are also affected, like the kidneys, the joints, and the dogs also experience bleeding.
You mentioned that the dogs get it from ticks. Is it only through ticks that the dogs can get Ehrlichia?
Yes, they get it from ticks only.
How do you diagnose Ehrlichia?
Here in our clinic, initially we do complete blood count. We have a hematology machine in our clinic, and we also use the antibody test.
For the complete blood count, Doc, what parameters are we looking at?
At CBC, we need to see or first look at the platelet count. Usually they have thrombocytopenia when presented.
Okay. Then, do you have a diagnostic kit or a kit that you use to diagnose Ehrlichia?
Yes, we do. Let me show you. This is the one that we use. This is antibody test kit for Ehrlichia.
Okay. How do you use it, Doc?
First, we need to collect blood sample. Then, we put the sample on this chamber. And there's a strip that we move from time to time, and there will be a mark stating it's positive for Ehrlichia.
how long will you be able to see if the test is positive or negative?
It takes around 21 minutes before we see the result.
So, Doc, what are the symptoms that we are looking at for Ehrlichia?
Symptoms, it depends on the phase of the disease. Initially, general signs like fever, lethargy, anorexia, and then later on, it progresses to bleeding and then limping because of the joint swelling. And some, based on our clinical experience, our kidney is also affected.
So, Doc, when do you recommend that our pet parents come to the vet? What symptoms are we looking at?
At first, when they see that their dog is not doing well, because those are the signs, usually they have fever, and then they are not eating well. You need to bring your pet to the veterinarian.
So, Doc, if the dog is positive for Ehrlichia, what are the treatments that we do for Ehrlichia?
For Ehrlichia, we usually give an antibiotic, and then based on the symptom, like of course thrombocytopenia, we give some supplements to boost the platelet count. And also one important thing is hydration. We usually put them under IV fluids, and then if they are have anemia, we give supplements to correct it. Then also on advanced stages like bleeding, we give anti-bleeding, and then usually confine them.
Okay. If Ehrlichia is left untreated, Doc, what will happen to the dog?
Well, in our cases, if left untreated, they will lead to anemia, and then due to excessive bleeding, and then some organs are affected, especially the kidney, and then they have this lameness. They also have seizure due to swelling, and some cases we also experience death on patients.
So, is there a high mortality rate for Ehrlichia, Doc, if the disease is left untreated?
If left untreated, the mortality, I would consider it also high.
Very high.
Yes.
Okay. And then, would you recommend if they have numerous dogs in the house and one dog is found to have Ehrlichia, should their dogs also, the other dogs should be tested also?
I will recommend so, because if one dog is affected, there is a large percentage that the others are also affected, even though they are still not showing some signs.
Are there some dogs that are more predisposed for Ehrlichia, or all dogs are predisposed to the disease?
We usually notice that it's based on the age, middle-aged dogs to older age.
So, Doc, how do we prevent Ehrlichia? Is Ehrlichia preventable?
Yes, we can prevent Ehrlichia by controlling the ticks. We use products like the Bubble Bath Plus shampoo, and we also use vitamins, a supplement, PetSure, in order to make them strong and resistant to any stress, which also would predispose to the disease.
Doc, how long will it take for a dog to recover from Ehrlichia? Usually, what is the span of time for recovery?
Well, it depends, but in our cases, within 48 hours upon treatment institution, they almost show signs like they become more active already. But usually it takes around 1 week to 14 days for the platelet to go back to normal. Yes.
Is there really a need for blood transfusion for ehrlichiosis?
Well, with blood transfusion, it depends on the case.
Okay. So, do we have any other questions from our pet parents for regarding Ehrlichia? Okay.
Okay, so we would like to invite Doc Carlo for the Q&A part.
Do we have a text in? Question?
Okay, so Doc Carlo,
Hello.
Zeth Montesa Zarco said that yan yung cause of death ng fur baby ko, severe anemia. So, how can you parang help them with the death of their fur baby to give them clarification na
Well,
it's really...
there are a lot of things that can cause anemia. So what you can do is, if ever it happens again, if you have another pet, what you can do is go to a vet if you notice that your dog is getting pale, and then for sure prior to that, the dog won't be eating well. And if you have a digital thermometer at home, you can check the temp. If the rectal temp is above 39.5, I think it's best to go to a vet and then have a CBC done, because a CBC will confirm anemia. And then if there is anemia, it would be best to find out what the cause is. So for that, I think it's best if the patient is in front of us para we can suggest the next steps. But definitely a CBC would help determine if there's anemia.
Okay, Doc. So, another question
Yep.
from Sabrina Ayunayon. What about Sarcoptic mange, Doc? Is it related to blood parasites?
Sarcoptic mange is different. It's a skin parasite. So Sarcoptic mange, it's not related sa blood parasite. But the thing is, it can affect people. So the best thing to do is if your dog is scratching, have a skin scraping test done. If the organism is viewed sa microscope, there are some medications that can be given for cases of Sarcoptic mange.
Okay. So, another question from Maria Bella Dianella. My dog doesn't have an appetite and has a fever. What can we do? Can this be Ehrlichia right away? Or
Well,
tests?
very general yung symptoms. So, like I said, if you're suspecting that the dog has fever, better have a digital thermometer at home, a rectal thermometer, and then you can check. If it's above 39.5 degrees Celsius, it's fever. And if your dog is feverish, it's best to, first, before going to the vet, if your dog is not vomiting, then hydrate your dog with something like Dextrolite. And then, after that, you can go to the vet. The vet will run some tests, like CBC or a blood chem or whatever might be necessary for the situation. And then from then on, the vet can find out what's wrong. So it doesn't mean that if your dog has fever, may Ehrlichia kagad. It can be heat stroke, can be another disease, can be another viral infection or a bacterial infection. So the thing is, if ever your dog has fever, don't self-medicate. Kasi some cases kasi if the dog has fever and Ehrlichia is predominant in the area, some clients tend to give doxycycline kagad because that's what happened to their other dog. So for cases like this, bring na lang your dog to a vet. Sure.
Okay. So, we have another question from Angelo. So, how long is the treatment for Ehrlichia?
Usually, so here in the clinic, every time a case comes, we advise the client that the minimum observation during confinement is 3 days. After 3 days, we check for appetite, we recheck the CBC. If the trend of the platelet count is going high, we send the dog home. But the treatment phase is at least 30 days. So, we send tablets at home dun sa client, and then we ask the client to come back after a week to check again the CBC because we have to monitor it. And we always advise the clients that even if the dog seems normal already, you have to finish the medications within 30 days. So some clients kasi they stop at the 14th day because the dog looks okay. But what happens is it occurs again, there's a relapse. So the dog gets confined again.
Okay, so we have another question from Carmela Di Tioco.
Mhm.
My dog is vomiting a yellowish substance with brown particles. He has a history of being acidic. Currently, he takes medications for it. However, it still happens and seems like it's getting worse. What will be your recommendation to help my dog heal permanently?
Okay, so usually when I would assume na yung medications is antacid because the vomitus is yellow. Yellow kasi is gastric secretions. But if it happens frequently, I would recommend to do an X-ray of the abdomen just to check if there's blockage or if the pylorus of the stomach is getting smaller. So that one can be assessed naman kung may magaling na ultrasonographer. Usually we refer. There's there are good ultrasonographers here in the Philippines for your pet. So for those cases, we refer to the ultrasonographer, and then if they find out that there's something wrong with the dog, if the treatment might be surgical or medical, we'll be able to do it. So,
Okay.
yeah.
So another question from Donna Apostol. My dog Sparky scratches a lot, and suddenly there seems to be bilog-bilog spots that appeared on his skin. So what could this be?
Okay, so the bilog-bilog lesions, it can be two things. If you're describing something that's circular lesions that have no hair, that's called ringworm. So that's a fungal infection. For fungal infection, there are some shampoos that you can use. Of course, it's best if the vet would perform a fungal test. And then if the bilog-bilog lesions that you are describing are small bumps, that can be mange or galis, and we may be able to do a skin scraping for that to confirm if it's mange. And then again, there are some other medications for that. So I think the best thing to do is to confirm what that is, and then we can medicate after.
Okay, so we have another question from Onard Odon. So, gaano kataas ang chance for recurrence ng Ehrlichia?
Well, I would say it's fairly high because it lives inside the cell. So that's the reason why we give doxycycline. Its concentration inside the cell is high. But the thing is, if down yung immune system ng dog, it will have a hard time to clear out the organism from the body. So it's best if you give something like vitamin C, like PetSure, para after treatment, you maintain it, and then pag na-boost na yung immune system ng body, the immune system will be the one to get rid of the organism para hindi siya mag-recur.
So, we have another question from LJC.
Mhm.
My dog is always itching and he scratches himself to the point where his skin becomes red or sometimes even bleeding. Apart from this, his fur is also shedding. So, any advice on this?
Okay, first, if your dog is scratching, use an e-collar, an Elizabethan collar, or the cone of shame. Because if you let your dog nibble on the skin, then ma-mutilate lang siya. So whatever the condition is, it will just get worse. The best thing to do is bring your dog to a vet, have a skin scraping done, a fungal test done, and then if it's mange, it will get treated with anti-mange medications, and if it's fungus, then there are also medications for that.
So we have another question from Joan Senarilos. My dog has Sarcoptic mange and every year bumabalik. I tried NexGard, Advocate, but now nothing seems to work.
Okay. Well, you just have to confirm again if it's really sarcoptic mange. I would suggest to do another skin scraping. I would take this seriously because if your dog is indoors, you have kids, then you might get infected as well. So the thing is, you have to confirm if it's sarcoptic mange, and then if there are other underlying conditions like food allergy or bacterial infection. Because even if you treat the mange and then there's bacterial infection, you don't give antibiotics, it will just recur.
Okay, so another one from Joyce Samonte. So what is the first aid when you see your dog vomiting a yellowish substance?
Well, I wouldn't be able to give you the dose, but usually I would recommend to give an antacid, like